Antiglobulin test, also called the Coombs test. It detects the presence of antibodies against circulating RBCs, in which we have the direct and indirect. Indirect antiglobulin test. Anti-human globulin Coombs reagent is added to the patient's RBCs. And RBCs agglutinate if RBCs are coated with anti-RBC antibodies used for AIHA diagnosis. While the indirect antiglobulin test is a normal RBCs added to the patient's serum. If serum has an anti-RBC antibody, RBCs agglutinate when the Coombs reagent is added. Is used for pre-transfusion testing. So looking at the image now at the bottom, does this patient have AIHA? Perform direct antiglobulin test, direct Coombs test. And patient's RBC with or without RBC antibodies and anti-human globin, which are the Coombs reagent, we combine them together. If the direct Coombs is positive, we will have the agglutination indicates the presence of, we have the anti-RBC antibodies. For example, in this case. And it would be negative if we have no agglutination, because where are these going to bind? They need the anti-RBC antibodies, which are right here. These have to bind on this. Looking at this picture too, you can see that. But here they will be just wandering around here and there because they cannot find the antibodies on the RBCs. Okay, now the next question is, will the recipient react against donor RBCs? Perform indirect antiglobulin test, indirect Coombs test. Patient serum with or without, you're just taking patient serum with or without whatever it has. I mean, it has the anti-RBC antibody, or it doesn't have the RBC antibody. Then you combine with anti-human globulin and donor's blood. Okay, and if it is positive, if this indirect Coombs test is positive, again, positive means agglutination has occurred. That would indicate that in the patient serum, there was the presence of anti-RBC antibodies. And if it is a negative, that means the patient does not have any anti-RBC antibodies. Okay. Yeah, that's good. So AIHA is autoimmune hemolytic anemia. Thank you. Moving on to the next thing.